Assalamu alaikum. As you can see, we are at the first mosque in Quebec, the Islamic center of Quebec, where we will learn how to perform a mortuary washing for a baby. Before beginning, it is important to have the sincere intention, niyyah, in the heart without saying it aloud. The intention should be to purify this baby in accordance with Islamic rites as an act of love and care. In this context, this video demonstrates how to carry out the ritual washing for a baby who breathed after birth. While the core steps align with those for an adult, the fragility of the infant's body necessitates a more delicate approach. Adjustments may be made based on the condition, always prioritizing respect, gentleness, and dignity in accordance with religious guidelines. Before proceeding, it's important to know, if the baby has any dirt, blood, or impurities on the body, we prioritize washing with soap. Otherwise, we follow the Sunnah method, using water, cedar water, and camphor water. In both cases, we make sure to use 3 types of water. If there are any pregnancy-related tissues or organs, simply pour water over them and place them together with the baby. After descending the stairs and turning right, you'll find the first door on the left leading to the funeral director's office. He is responsible for providing all the necessary details in advance regarding the washing process, including the date, time, and the person in charge. For a baby, only 2 sisters and the mother, if she wishes to participate, are allowed to be present during the wash. This ensures a level of intimacy and tranquility during this delicate act. The rest of the family should remain in the exhibition room to the right. This serves as a gathering and prayer space while the wash is being performed. It's also a moment for the family to reflect and pray. Before crossing the second-to-last door and gathering the necessary materials, keep in mind that unlike an adult woman, guiding the washing of a baby requires additional information. For this reason, clear and effective communication with both the funeral administrator and the mortuary wash lead is essential. This helps ensure that simple yet important questions are addressed, which are key to the smooth execution and organization of the mortuary washing process. For instance, it's important to know if a family member, particularly the mother, will participate in the wash, as this will influence how the process is organized. Additionally, confirming the time and date of death often found on the funeral bag label helps in determining the appropriate steps and care for the body. Lastly, knowing whether the baby is a boy or a girl, as it can affect the choice of kafan, shroud. Clear communication ensures every detail is accounted for, making the process more organized and respectful. We arrive at the last door, which leads to an area where we find the first part of the materials for the wash and the door to the washing room. There are several lockers with equipment. First, take an apron, put on boots, and retrieve the kafan package. For a baby girl, the kafan consists of 3 pieces of cloth, including the thobe, camis. For a boy, there is no camis. Inside the washroom, you'll find the following materials: mask, gloves, musk, scissors, 3 cotton balls for the mouth, 3 cotton balls for the nose. Twist them for use. You can also use cotton swabs for the nose instead of cotton balls. Open the kafan kit and take out the washcloths and sutra towels to gently cover the baby's private areas. Next, transfer a small amount of jujube powder, cedar, into a handled bowl. Then, crush half a square of kafour into a fine powder. After the preparation, retrieve the baby from the refrigerator and place him on the table. Carefully remove the plastic wrapping, then cover his intimate areas with a clean towel immediately. Remove any hospital bracelets if present. Then, dispose of blankets or clothes in good condition if the parents do not wish to keep them. Before starting, Check whether the baby has undergone an autopsy by looking for sutures or staples on the chest or head. If present, handle the body gently and avoid pouring water on these areas to prevent potential damage, such as bleeding or the opening of wounds. Embalming is generally performed to preserve the body after death, particularly when extended preservation is required. Perform the wash with dignity and respect. For a baby, there's no need for a dua as there are no sins to forgive. The procedure should be silent and calm unless there's a need to explain the process to the mother. The washing moment can be very emotional for the family. If the mother wishes to participate, remove the baby from the plastic bag beforehand and cover its private parts with a towel to ensure respect and protect the mother's feelings. This allows her to see her baby in a dignified state rather than in a plastic bag, making the experience less traumatic. Bismillah, we can begin. Once the water temperature and flow are properly adjusted, gently lay the baby on a towel, ensuring their private area remains covered. Moisten a washcloth with water, then thoroughly wet it and gently cleanse the baby's intimate areas, istinja, being careful not to apply too much pressure. Then, you can begin the minor ablution by rinsing the right hand, followed by the left. Using cotton balls, gently wipe the mouth 3 times from right to left, like this. Then, clean the nose 3 times using the cotton balls that we twisted ourselves, ensuring that a different tip is used for each nostril. Next, gently wash the face with your hands to maintain control, ensuring that some water flows over the face while avoiding any from entering the nose or mouth. Wipe over the arms, from the fingertips to the elbows, 3 times, starting with the right arm, then the left. Wet the hair, ensuring water flows from the front to the back of the head, and clean the ears with your fingers while preventing water from entering inside them. Finish by washing the right foot first, then the left, each 3 times. After completing the minor ablution, the next step is the major ablution, which involves washing the body in a specific sequence. Repeat the process on the left. Then, gently turn the baby and pour water over the back, allowing it to flow naturally without excessive handling to ensure full purification. Prepare the soap by mixing it with water. Then, gently wash the hair and the face with your hands to maintain control and avoid getting water in the eyes, nose, or mouth. We will clean the body with washcloths to minimize water usage, avoiding rubbing as much as possible and instead gently patting. We will start with the right side, then the left, and finally the back. Try to rinse the baby in one go, avoiding going over the same spot twice. Next, Cedar, derived from the jujube tree, is valued for its cleansing and purifying properties. With natural antibacterial and antifungal benefits, it gently removes impurities while remaining safe for delicate skin. In Islamic tradition, it is not only a physical cleanser, but also a sunnah. The Prophet, peace be upon him, instructed its use when washing the deceased, including his own daughter Zainab. Prepare the cedar by mixing it with a small amount of water and stirring well by hand to dissolve any lumps. Gently apply the foam to the hair using your hands, ensuring it penetrates from the front to the back of the head. Continue using your hands to gently pour some of the cider-infused water onto the face. Then, pour a small amount of water on the right side, followed by the left. And finally over the back to complete the purification. The washing is complete. We will first replace the wet sutra with a dry one, as well as the towel on which the baby is laid. Wring out the sutra soaked with cedar, then throw it away. It is now time to gently dry the baby's body. We will begin drying the baby by gently patting, making sure to dry between the small folds of the skin. The table was properly cleaned and dried before proceeding. The kafan kit was opened, and the baby was gently placed on their back, with their head positioned facing the opening of the kameez. The first layer of fabric used to wrap the baby is called the izar. Once the baby is covered on the right side and the sutra towel is removed, the excess fabric is gently wrapped around and tucked underneath to keep it secure and well-fitted. Then, the left side is folded over to fully enclose the baby. Next, pass the baby's head through the kameez opening. Fold the remaining fabric around the body. Next, gently place the triangular hijab, folding the top part if needed before positioning and adjusting it. Make sure to leave a small finger-width space under the chin at the neck to avoid tightening the hijab too much. We will now take the kafur powder and sprinkle it over the kafan. Cover the baby with a final piece of fabric, starting with the right side. Then the left. Tie the kafan with 3 cloth strips, one around the middle, one below the feet, and one above the head. These ties help secure the shroud, ensuring that the fabric remains properly wrapped around the body and does not shift during handling or burial. For a boy, the process remains the same, but without the kameez or hijab. Once the kafan is secured, place the baby in the coffin and close it. To avoid confusion, if there are multiple babies, attach a temporary label with the name or family name, or simply write it down. Then, draw an arrow on the top to indicate the position of the head. In this second and final part of the video, we will cover the mortuary washing of a fetus or stillborn baby beyond 4 months, 120 days of gestation. These babies are often received in a plastic bag or sometimes in a box, wrapped in a disposable pad. Given their fragility, they must be handled with the utmost care to ensure their dignity is preserved throughout the process. In some cases, the baby may arrive with detached or missing limbs. If possible, these should be gently repositioned before beginning the wash. However, if certain parts cannot be placed back properly, they should be carefully wrapped within kafan. The washing process must be done with extreme caution, using minimal water to preserve the body's integrity and avoid further damage. If the fetus is less than 120 days old, but the limbs are clearly visible, then the mortuary wash may be performed in the same manner as it would be for a fetus older than 120 days. However, when you receive a fetus that is less than 120 days old with no visible limbs, simply wrap it in a clean cloth and gently place it in a box for burial. The ritual washing for a fetus over 120 days follows 3 essential steps, each using a specific liquid. First, cleansing is done with soapy water to remove impurities. Next, purification is carried out with cedar-infused water, following the prophetic tradition. Finally, preservation is completed with kaffir-infused water, which helps prepare the body with a pleasant scent. After the preparation, retrieve the baby from the refrigerator and place him on the table. Remove any hospital bracelets if present. Then, dispose of blankets or clothes in good condition if the parents do not wish to keep them. We begin by gently washing the fetus with soapy water to cleanse the body and remove any impurities. Due to the fragility of the body, minimal handling is required to preserve its integrity. Next, we rinse the body with water infused with cider leaves. As explained earlier, cedar is a natural purifier known for its cleansing and antibacterial properties, ensuring both physical and spiritual purification. With it, we now begin rinsing the body gently and with intention. In the final rinse, kaffir is added for its antiseptic properties. It helps purify the body, slows bacterial growth, and leaves a gentle, fresh scent. This follows the Sunnah of the Prophet, peace be upon him, who recommended kaffir as a final gesture of care and dignity. With it, the final rinse is gently performed. Once the washing is complete, the wet towels are replaced with dry ones. The baby is then gently patted dry, making sure to handle the body delicately to prevent any damage. Once wrapped, it will be carefully secured using fabric ties with the utmost care. Once the fetus is wrapped, it is carefully placed in a small coffin. If needed, a label with the family name may be attached to avoid any confusion. This marks the completion of the preparation before burial, ensuring that the baby is laid to rest with honor and dignity. I hope this clarifies the process. May Allah accept your intention to learn and reward your efforts. Thank you for watching.